Namaskar. Welcome to this edition of the News Bulletin. In the headlines today, Prayas program organized for contract labor of Rourkela steel plant. Workshop on Arohan, the ascent, organized. And more than 300 villagers benefit from the multidisciplinary health camp organized by Rourkela steel plant in Nuagaon block. And now the news in detail. The 34th session of Prayas, an awareness program for contract labor, was organized on 26 February 2020 at Hot Strip Mill 2 Administrative Building. In all, 48 contract labor working in the area attended the program. Mr. T.G. Kanekar, GM Personnel CLC and Projects, facilitated the interaction session where he clarified various doubts of contract laborers pertaining to benefits, statutory provisions like ESI and Provident Fund, etc. Special emphasis was laid on safety, and a session on behavioral-based safety was taken by Mr. Avinash, Manager Personnel. This highlighted the importance of safe working practices and the roles and responsibilities related to safety at the work spot. Mr. T.A.K. Patro, Labour Inspector Personnel CLC, briefed the participants on rights, benefits, responsibilities and issues such as wage structure, bank payment, pay slip, ESI and PF coverage, medical benefits, etc. Ms. Smruti Shri Panda, Executive Assistant Personnel CLC, dealt with various provisions of SA 8000 like child labour, forced labour, provision of health and safe working environment, rights, discrimination, working hours, safety, wages, etc. through movies, video clippings and stories. The program was coordinated by Personnel CLC team. Notably, Prayas is a communication program being organized by RSP for contract laborers working in RSP for their welfare, wherein standards and provisions are explained to them in a simple and lucid manner. Till date, 1621 contract laborers have been covered under this scheme and benefited out of it. A two-day workshop of the HR initiative Arohan, the Ascent, organized at CPTI on 28th and 29th February. Executives in the level E3 to E7 attended the workshop. The topics that were covered during these 2 days are business scenario and dynamics of steel industry and future challenges, stakeholder management, building professional relationship with vendors, emotional intelligence, positive attitude and self-motivation, culture of pride, passion and appreciation, optimum utilization of resources and materials, innovation and creativity, effective decision-making at work, and optimum utilization of human resources. The program was coordinated by Mr. S.K. Shukla, Junior Officer HRD, and Mr. B.K. Patra, Senior Instructor CPTI. A multidisciplinary health camp was organized by Rourkela Steel Plant RSP at Bagdega UP School Bagdega in Nuagaon block on 28th February. The camp was organized by the Corporate Social Responsibility CSR Department in association with the Medical and Health Services M&HS Department of RSP. Mr. M.V. Apparao, GM in charge, Ms. Munmun Mitra, DGM, Mr. A.K. Parida, Senior Manager, and other officers of CSR Department visited the camp and interacted with the villagers. Doctors of RSP, namely Dr. P. Rath, Joint Director Pediatrics, Dr. R.R. Mahanti, Joint Director Ophthalmology, Dr. N.K. Behra, Senior Deputy Director Skin, Dr. Binayak Rath, Senior Consultant Surgery, Dr. Gautam Dash, Senior Consultant ENT, Dr. Nivedita of ONG examined the patients and also treated them. Mr. C.S. Baharimwar, Senior Manager Medical CSR, coordinated the event. In all, 311 patients were examined in the camp and provided free medicines and consultation. Besides, 73 patients were identified for further treatment at Ispat General Hospital under various CSR schemes, namely Project Sunayana for free eye surgery, under Project Shushruti for medical intervention of people with hearing ailments, Project Charak for provision of free surgical interventions, Project Surabhi for treatment of gynecological disorders, Project Sneha for leprosy patients, Project Akshay for treatment of TB patients, and Project Swavalamban for children with cleft lip and palate disorder, claw foot, hearing ailment, and vision impairment. It is worth mentioning here that the medical camps being organized by RSP in periphery villages not only reach out to the people living in remote villages but also extend costly surgical interventions for free at IGH to the identified people suffering from grave ailments. And that's all for now. Namaskar.